Hello, and welcome to today's webinar on what's new with PFAS in Massachusetts and across the U.S. I am Dr. Barbara Malkus, President of the Board of Directors for the Massachusetts Breast Cancer Coalition, and I'd like to thank you all for joining us today. Massachusetts Breast Cancer Coalition is dedicated to preventing environmental causes of breast cancer through community education, research advocacy, and changes to public policy. I am delighted to welcome today's presenter, Dr. Laurel Schaider. Dr. Laurel Schaider is a senior scientist at Silent Spring Institute, where she leads the Institute's water quality research on PFAS and other contaminants of emerging concern. She studies PFAS chemicals in drinking water, consumer products, and food packaging. She is also an expert on drinking water contamination from septic systems and environmental justice disparities in drinking water quality. She is the lead investigator of the PFAS REACH, which stands for Research, Education, and Action for Community Health, communities affected by PFAS water contamination. She is part of the University of Rhode Island's STEEP Superfund research program and co-leads community engagement activities on Cape Cod. Additionally, she is the lead investigator of a study by ATSDR, the Agency for Toxic Substances and Disease Registry, and the Centers for Disease Control and Protection on PFAS Health Effects in Hyannis and Ayer, Massachusetts. Before joining Silent Spring, she was a research associate at the Harvard T.H. Chan School of Public Health. Dr. Schaider earned her master's and PhD in environmental engineering at the University of California, Berkeley, and a bachelor's degree in environmental engineering from MIT. Dr. Schaider, welcome to today's webinar. I know we have a lot to learn from you, so I'm going to let you have the floor.
Great, thank you very much, Dr. Malkus. It's a pleasure to be back, and thanks to everyone for joining today. I always appreciate the opportunity to be part of the MBCC webinar series. So I'm here today to provide some updates about what's happening with PFAS here in Massachusetts and across the US. And I'll mention that for all of our federally funded research right now on PFAS and water quality, we're really fortunate to be working closely with Cheryl Osimo and others from Massachusetts Breast Cancer Coalition. So for my talk today, I'm going to start by giving a quick overview of PFAS, just as a reminder for people who may not be as familiar with PFAS chemicals. I'll provide some updates about the status of PFAS in public drinking water supplies and private wells here in Massachusetts. I'll talk about a recent Silent Spring Institute study on PFAS in children's products and provide some updates about state-led legislation relating to PFAS in products across the country. I'll mention several health and exposure studies currently underway here in Massachusetts, and then talk about some local and national developments related to education of medical professionals when it comes to PFAS chemicals. So I'm sure many of you who are tuning into today's webinar are already quite familiar with PFAS, but for those of you who are new or could use a refresher, PFAS stands for per and polyfluoroalkyl substances. It's an umbrella term. It includes many different individual chemical compounds. Most recent estimates put that number at over 12,000 different chemical structures that are considered to be a PFAS. As a family of chemicals, they are extremely resistant to degradation or breakdown in the environment, owing to their many carbon-fluorine bonds, which are some of the strongest bonds in organic chemistry. They're also really mobile in the environment. They can move through groundwater. Some of them can end up in the air and cycle in the global atmospheric cycle. They've been found in the blood of polar bears at the Arctic. So they're really global pollutants, and they're going to be with us for generations. PFAS aren't new. PFAS have been used in consumer products since the 1950s, but it's just really been in the past, I'd say 10 years, when they've really started to gain a lot of attention from scientists and activists and regulators, and this is due in large part to their widespread discovery in drinking water supplies. For those of you who are curious what the chemical structures of PFAS look like, I'm showing two of them here in the upper right corner. And if you've heard of any specific PFAS chemicals, you've probably heard of PFOA and PFOS. They both are characterized as long chain PFAS. This blue zigzag in the middle is a carbon backbone, and the O in their name stands for octa. So they both have an 8 carbon chain backbone to their structures. These Fs around here are fluorine. Again, these are fluorinated organic compounds. And they have properties that make them in some ways like soaps or surfactants. And they also have properties that are like fatty acids. So part of their chemical structure does not like to be in water and is more soluble in oils. And then some of them have different chemical structures on the right side that make them more water soluble. If you're curious to learn more about PFAS after today's webinar, you might want to consider watching the Hollywood film Dark Waters with Mark Ruffalo and Anne Hathaway. It features a community in West Virginia that was impacted by a DuPont plant and the efforts of a heroic lawyer to bring justice for the community. There's a related documentary called The Devil We Know that I would recommend as well. So PFAS are not really a household name, and while many of you may have heard of PFAS before, in general, people haven't heard of PFAS. This is not something that shows up on product labels, but PFAS are common in our everyday lives. So if you ask people if they've heard of Gore-Tex or Scotchgard or Teflon, people generally have heard of those types of trademark names, and they likely have products with those trademarks in their home. PFAS can show up in a number of other types of products where you might not expect to find them, like microwave popcorn bags, Oral-B Glide dental floss, fast food and microwave popcorn wrappers, and cosmetics. And every day I'm learning about a new use of PFAS, such as in guitar strings and rock climbing ropes. So because they're chemically persistent, they're widely used in products, and they can also accumulate in people's bodies, exposures to PFAS are widespread. Testing by the CDC, which is the Centers for Disease Control and Prevention, has found PFAS in the blood of over 99% of people in the US whose blood they've tested. As a family, each PFAS chemical has a slightly different characteristic. Some PFAS, such as PFOS and PFOA, are what we call long chain PFAS, and they're extremely long-lived in the body. So they have what's called a long half-life. So that means even if you stopped being exposed to any new PFAS or PFOA, it would take years for the amount in your blood just to go down by half. And then it would take that same amount of time to go down by another half. So for these long chain PFAS, these will be in our bodies for many years to come. Newer PFAS chemicals that are being used more widely in current products can also stay in our bodies, but not for as long, for weeks to months. So not as long as the long chain PFAS, but it's still concerning that they do have the ability to stay in our bodies for extended amounts of times. And many PFAS have not yet been studied to evaluate their longevity in the human body. All of this is concerning because from what we know, exposures to PFAS have been linked to many harmful health effects. These can include elevated cholesterol, changes in thyroid hormones and thyroid disease, decreases in birth weight, preeclampsia, immune system suppression, including decreased vaccine response, particularly in children. And this has raised concerns in PFAS-impacted communities about the COVID epidemic and raised questions about potential increased susceptibility to COVID among people who've had high PFAS exposures. Higher levels of PFAS have also been linked to certain types of cancer, specifically kidney and testicular cancer. Studies in laboratory animals have shown that PFAS can also alter mammary gland development. And at Silent Spring Institute, we think that our research focuses on environmental causes of breast cancer. And we think that chemicals that can alter mammary gland development may increase breast cancer risk. Studies in people have also shown decreased duration of lactation in breastfeeding mothers linked to PFAS exposure as well. So a lot of my work has focused on PFAS in drinking water, but our studies at Silent Spring have also looked at other pathways of exposure. We led a study in 2017 that found PFAS to be frequently present in fast food wrappers. We also found that PFAS or consumption of fast food was linked to exposures to PFAS in the general US population. We also found in another 2019 study that exposures to PFAS were linked to the presence of stain-resistant furniture in the home and use of Oral-B Glide dental floss. So first off, I'm going to start talking about drinking water, and I have tried to focus on some of the more recent updates. And I'm not doing a deep dive into any one topic. I wanted to present some different topics and also to provide some resources. So if one of these topics catches your interest, you can dig deeper to learn more. So it's likely that you may have seen headlines related to PFAS, or as they're sometimes called, forever chemicals in drinking water. For instance, Cambridge actually switched from using its water supply to using MWRA water after PFAS were found to exceed the state standard. Other towns such as Wayland, Wellesley, many other communities have found PFAS in their water supply, and sometimes at levels above the Massachusetts standard. We're also becoming more aware of PFAS in private wells and different types of sources, such as a composting facility in Westminster that contaminated private wells in Western Massachusetts. So across the country, there are thousands of known and suspected sites of PFAS contamination. What I'm showing here is a map that's on our PFAS exchange. The PFAS exchange was developed by the PFAS Reach study. So this is a study that's led by Silent Spring Institute. We're collaborating with researchers from Northeastern University and Michigan State, and with community partners, including Massachusetts Breast Cancer Coalition, Testing for Peas and Slingshot. And our team, together with the PFAS Project Lab at Northeastern University, created a map that shows information about known and presumptive contamination sources. This is based on a contamination site tracker that the Northeastern team developed. Our site also provides community resources, information about actions that each individual state has taken to address PFAS, and information about community groups. And the goal of this is to really empower people who find out about PFAS or want to know more about PFAS in their communities with resources for finding that type of information. You'll notice that the dots here showing the known and presumptive contamination sources are not necessarily evenly spread out across the country. Often where you see the dots closer together, that's an indication of a state that's actually taken the initiative to do more testing. And where you don't see as many dots, that in some cases just means that those places have not actually been tested yet for PFAS. So what are the ways that PFAS can get into water? The places where we tend to see the highest levels of PFAS in water include areas near fire training academies and airports. That's because of the widespread use of a certain class of firefighting foams called AFFF, which contains relatively high levels of PFAS. So groundwater near areas where fire training activities or emergency response was conducted tend to have among the highest levels of PFAS. High levels are also found close to fluoropolymer production facilities, so where these chemicals are actually manufactured, as well as other industrial sites where PFAS are incorporated into products, so Teflon-coated products, for instance. So that's where we tend to see the highest levels in the environment, but PFAS are showing up in many other places as well, not necessarily at such high levels, but more distributed sources of PFAS can include wastewater treatment plants and septic systems. So because PFAS are common in the products in our homes, the wastewater that leaves our homes can pick up traces of these PFAS chemicals, and they can end up getting into the environment through wastewater discharges. Landfill leachate also can carry PFAS. For unlined landfills, that can be a source of PFAS right into groundwater. For lined landfills, where that leachate, which is the water that percolates through the waste in the landfill, that can go to a wastewater treatment plant, and PFAS are not well removed during wastewater treatment. And so those can end up getting discharged into the environment either through the water effluent or through solid sludge or biosolids. We're also increasingly learning that locations where biosolids have been applied to the land can also be sources of PFAS into groundwater. So despite the amount of evidence we have that PFAS can be harmful to our health and extensive evidence that these are widespread in drinking water supplies, the EPA has not yet established enforceable drinking water standards for any PFAS chemicals. They have taken some steps. In May 2016, they issued a non-enforceable lifetime health advisory of 70 parts per trillion, that's PPT, also written as NG/L, sometimes nanograms per liter. And this is for the total amount of PFAS and PFOA, either individually or combined. In 2022, so just this past June, they issued updated health advisories for PFOA and PFAS. And so these are much lower than the 70 parts per trillion. For PFOA, the advisory is 0.004 parts per trillion. And for PFAS, it's 0.02 parts per trillion. So it's over 1,000 times lower than the level that they had previously established in 2016, and lower than pretty much any analytical chemistry lab is able to measure. So it's a really strong indication that the previous health advisory was not adequately protective and reflects new evidence that PFAS can be harmful at even lower levels. They also issued updated advisories for 2 newer PFAS chemicals, Gen X and PFBS. EPA, under the Safe Drinking Water Act, does have a rather lengthy process that it has to go through to set a new drinking water standard. And so they are moving forward with standards for PFOS and PFOA. They've said that by the end of 2022 that they will issue draft standards, again, just for PFAS and PFOA. There's a comment period and a review process after those draft standards are issued, and they've said that by the end of 2023 that they will finalize the standards. Again, that's just for PFAS and PFOA, 2 chemicals specifically. So a lot of state regulators have taken action more rapidly than EPA because they thought that the 70 parts per trillion standard was not adequately protective. And they also were looking beyond just PFAS and PFOA. So the states here shaded in blue are states that have proposed or adopted standards or guidelines that are stricter than or in advance of guidelines set by the EPA. So some of these are enforceable standards. So that means that water suppliers have to test and take steps to treat any PFAS contamination that's discovered. They've included additional compounds beyond just PFOS and PFOA. Some of these standards include stricter monitoring requirements, and numerically they're quite a bit stricter than the 70 parts per trillion that EPA established in 2016, mostly in the range of 10 to 20 parts per trillion. Some of these standards address PFOS, PFOA, and several other compounds individually. Some of them refer to the sum of multiple different PFAS chemicals. So Massachusetts is one of the states that has taken action in advance of the EPA setting drinking water standards. So the Massachusetts standard is called the MCL, which stands for maximum contaminant level, and it was adopted in 2020. And it's among the strictest regulations among all the states in the US. So the Massachusetts MCL limits the amount of PFAS in drinking water to 20 parts per trillion, that's PPT, for what they call PFAS 6. So this is the total amount of 6 common PFAS chemicals. So PFOA and PFOS that we've already talked about. Again, these are 8 carbon chain compounds. They also include the 7, 9, and 10 carbon chain compounds that are similar to PFOA, and then PFHXS, which is a 6 carbon chain compound. It commonly shows up in areas impacted by firefighting foams. So one of the implications of having a standard is that public water supplies in Massachusetts are now required to test for PFAS. So according to the Mass DEP's website, over 1,400 public water supplies are now required to test for PFAS. So looking at the data that was available online, it showed that 163 public water supplies have detected PFAS 6 above that standard at least once. So that's 11% of public water supplies. So when we think of a public water supply, we probably think of our town water supply. So many public water supplies are community systems that serve municipalities. But public water supplies is a broader term. It also includes non-community systems that serve schools, condominiums, municipal buildings, businesses, and other institutions. So if you're curious to know more about what's happening in your own community, you can go to the website. It has a very long URL, so I made a QR code so you could scan this to go to the website. And it shows all the public water supplies that have detected PFAS 6 above the standard. So you can zoom in and you can click on different towns. The green dots are community water systems, and then the blue and yellow dots show non-community systems. So I'll show you a couple of examples. So here you can see the Cambridge water supply is one of these systems, and you can hover over and get information about what's happening. Again, Cambridge has switched to using MWRA water while they put in place new treatment to filter out PFAS from their own water supply. If you scroll down here, you can get more information on the Cambridge drinking water site. Hyannis, I'll talk more about Hyannis in a minute. This is a community where we at Silent Spring actually discovered PFAS back in 2010, and Hyannis has really been on the leading edge of addressing PFAS contamination. All of the public wells in Hyannis are now being treated to remove PFAS, and so that kind of information is included on this website. Again, not all public water supplies serve a town. Here in Western Massachusetts, this is a non-community system in Petersham, like a little close to my heart here because I spent a summer at Harvard Forest in Petersham. This is a community, it is a forest, it's a long-term ecological research site, and yet because of the widespread use of PFAS and their prevalence in the environment, PFAS can show up even in really rural and remote areas. So there are a few things to keep in mind, and many of you may live in a community that's recently tested for and discovered PFAS at or above the state standard. So some things to keep in mind is that current levels may actually be lower than the highest levels that used to be present in the water. So take the case of Hyannis or the town of Ayr, where we've also been conducting research. The water supplies have put in place treatment. So the water now actually doesn't contain detectable levels of PFAS, but it did exceed the standard in the past. It's also important to keep in mind that public water supplies often pull water from many different either groundwater wells or different ponds or surface water bodies. So while an individual sample of water may be above the standard, the water at your tap might not actually be above the standard, depending on the mixing of water from different sources. I think it is also important to keep in mind that many of the recent detections have been in the range of, say, 20 to 100 parts per trillion, so over the standard, but still sort of close to the standard. Some of the earlier detections, like in Hyannis, were at more than 400 parts per trillion for PFAS. Not to say that finding PFAS over the standard isn't important to address, but it is important to keep in mind that there's sort of different levels or different orders of magnitude of contamination in different communities. So many people here in Massachusetts are served by a public water supply, about 93% of the population, but 500,000 people here in Massachusetts actually have a private or domestic well. So what do we know about PFAS in private wells in Massachusetts? So the Massachusetts Department of Environmental Protection has actually had a program underway to measure PFAS in private wells throughout the state. So for 80 towns that are served predominantly by private wells, homeowners with a private well have the opportunity to sign up to get their water tested for PFAS. So some of the testing is complete and those results are available on the Mass DEP website. So we had an intern over the summer who helped compile and present spatially results from some of the private well testing in Massachusetts. And there are a number of towns where private wells have been found to exceed the Massachusetts standard. And we have a website actually for private well owners in Massachusetts, privatewells.silentspring.org, with information to help interpret the results of routine private well testing and a summary of what's known about PFAS in private wells. And what you'll notice is that there are a number of places where samples have tested over 20 parts per trillion, so in orange, or even over 100 in red. And you see that they're also spread out kind of all over the state. And sometimes these can show up in sort of rural areas. For instance, here in Carlisle, which is a pretty spread out and rural community, they found almost 400 parts per trillion in a private well. And I think it's challenging because we can't always necessarily predict where we're likely to see the highest levels, and there's still a lot that we're learning about important sources. I also wanted to mention one of the research collaborations that we're a part of, which is called STEEP, which is Sources, Transport, Exposure, and Effects of PFAS. This is led by the University of Rhode Island in collaboration with Harvard University and Silent Spring Institute. I co-lead the community engagement core for STEEP, so we work do a lot of our work on Cape Cod, and we work really closely with Massachusetts Breast Cancer Coalition, the Sierra Club Cape Cod Group, and the Mashpee Wampanoag Tribe. While we're on the topic of private wells, I wanted to emphasize that we have done testing of private wells on the Cape. The results of the first round of testing that we conducted in 2018 have been previously presented. You can see the results here at this website. One of our findings was that wells with higher levels of nitrate on average had higher levels of PFAS, which is consistent with the idea that septic systems can be one important source of PFAS into the groundwater in Cape Cod. We had some delays with the second phase of our study due to COVID. We went out late last year to collect a second round of samples, and we are still in the process of analyzing those results, and we'll be sharing those with the people who took part in the study and with the community as soon as we're able to. Okay, so moving on from drinking water, I want to tell you now about a study that Silent Spring Institute published earlier this year on PFAS in textile products for children and adolescents. This project was made possible with funding from the Commonwealth of Massachusetts, and we wanted to acknowledge the hard work of Massachusetts Breast Cancer Coalition in helping make that funding possible to do this work. So this study focused on textile products for children and adolescents, and we looked at, one of the questions we had was whether information on product labels would be useful to parents and guardians to figure out which products were most likely to contain PFAS. So what we found was that PFAS were often found in textile products, particularly those that had some sort of a water-resistant or stain-resistant assurance on the label. We also, as we purchased products, we kept track of which ones had some sort of a green assurance. And we intentionally purchased water-resistant products, stain-resistant products, and we wanted to make sure we included some that had green assurances. So this could just be something generic like saying non-toxic or eco-friendly, and then others had certain certifications that are intended to indicate at least some lower level or less toxic chemicals in the products. So we found that PFAS were more likely to be detected in products that were water or stain resistant compared to those that had no water or stain resistant assurances. We ran a couple different types of tests on the products. We used total fluorine as a screening method to figure out which products were most likely to have intentionally added PFAS. And then we also looked for PFAS that could be extracted from products into solvent. And when we did that testing, we found that in fact, the only products that had extractable PFAS were those with some sort of water or stain resistant assurance. So that indicated that these were intentionally added to improve product performance. We did also see, and I'm showing here in the bar, that even products that had some sort of a green assurance were pretty much just as likely to contain PFAS as those with without that kind of a green assurance. And that wasn't necessarily surprising. PFAS are kind of a newer class of chemicals in terms of awareness of their toxicity and their widespread use in products. And so green assurances either don't include PFAS or do allow for PFAS at levels higher than those that we found in our products. We did also find certain long-chain PFAS in our products, despite the fact that long-chain PFAS have been phased out of production here in the US and in Europe. So some of the implications of our study. So, is it useful, or does information on product labels help consumers avoid PFAS? And the answer is yes, but to a certain degree. So avoiding water and stain resistant products can help reduce your exposure, but relying on product labels alone isn't necessarily always a reliable indicator of the presence of PFAS. And as I said earlier, PFAS itself often doesn't show up on product labels. Another idea that I wanted to convey was that when we looked at the total amount of fluorine in products, and then we looked at the individual PFAS chemicals that we were able to extract, there's often a large gap. And so there was a lot of that total fluorine that we weren't able to account for with our measurements. And so it suggests that there are other PFAS in these products that we're currently not capturing with current analytical methods. So here in Massachusetts, there have been a number of legislative initiatives to restrict PFAS in products. So I know over the past legislative cycle, there were some bills related to banning PFAS in food packaging, restricting PFAS in consumer products such as carpets, rugs, and textiles, limiting PFAS in firefighting, firefighter protective gear, and also restricting PFAS and other toxics in children's products. As far as I know, those did not actually get adopted over this past cycle. I know Massachusetts Breast Cancer Coalition and other organizations advocated for these bills, and I imagine that they will be reintroduced in the upcoming cycle. In other states, there have been some legislative initiatives that have been adopted. So I'll mention a couple of these. So one is that in Maine in 2021, they approved a ban on PFAS, intentionally added PFAS in many everyday products. And this will go into effect in 2030. So there are some exemptions for products that are required for health or safety, but this is a really far-reaching ban. And then this past year, a ban was adopted in California that would ban PFAS in cosmetics and in apparel. And again, both of these bills are considering PFAS as a class. They're not singling out just PFAS or just PFOA. And I think that is a really important component when we're addressing PFAS, to not try to tackle them one at a time, but to really think about them as a class. So now I wanted to let you know about two health and exposure studies that are currently underway or have been completed here in Massachusetts. So the first one that I'll talk about is one that's near and dear to my heart because I'm leading it. It's called the Massachusetts PFAS in Your Health Study. It's currently underway in Hyannis and in Ayer, which is west of Boston. These are both communities where the public drinking water supply was contaminated by PFAS from the use of firefighting foams for fire training activities. So Silent Spring Institute is leading the study together with researchers from Harvard School of Public Health and Eastern Research Group. And our local partners are Massachusetts Breast Cancer Coalition. We've been working really closely with Cheryl Osimo and her team on Cape Cod, and with our new friends at the People of Air Concerned About the Environment, or PACE, in Air. So a little bit more about the study. So our study is actually one of 7 projects that's funded under a much broader umbrella called the multi-site PFAS study. So this is being funded and coordinated by the Centers for Disease Control and Prevention and another federal agency called ATSDR, which is the Agency for Toxic Substances and Disease Registry. So CDC is funding research teams in 7 states to work with local communities, each of which has experienced PFAS contamination of water supplies. So we are currently enrolling adults and children both in Hyannis, and we're just this week starting data collection in the town of Ayer. And our target is to recruit 1,000 adults and 300 children across both communities. We started collecting data in Hyannis late last year, and we just started collecting data in Ayer. And for both sites, we will be collecting data through the end of May of next year. And the broad goal for the multi-site study is to improve our understanding of PFAS health effects. While there is a lot that we do know about how PFAS can affect our health, there's still a lot that we don't know in terms of the levels of exposure that can cause health concerns, the exact links between specific chemical or chemical mixtures, and a wide range of different health effects. And having this study take place in communities with water contamination will provide new and important information. I wanted to give a shout out to our lead recruiter in Hyannis, Betty Ann Vivas, who's a longtime MBCC volunteer. And if you're curious to learn more about our study, you can visit our website or check us out on Facebook or Twitter here. And for those of you who are on the Cape and want to know more about what's going on in Hyannis, we are actually having an info session tomorrow at Barnstable Town Hall at noon. There was an article about it today in the Cape Cod Times, and you can learn more about this info session on the Silent Spring website. I also wanted to talk about another initiative that CDC and ATSDR are conducting in PFAS impacted communities across the country. So separate from the multi-site study, which is specifically looking at health effects of PFAS, they also conducted a series of exposure assessments in 8 communities where the water was impacted by the use of foam at military bases. And one of those sites was here in Massachusetts. So Westfield had PFAS contamination from the Barnes Air National Guard base. And so one of the ATSDR exposure assessments was conducted in Westfield with over 450 people taking part. And if you're curious to learn more, I put the link here for the summary. Some of the key take-home messages were that blood levels of 3 PFAS chemicals were higher than the national average. So this is showing age-adjusted data for Westfield here in dark blue and the national average here in lighter blue, particularly for PFHXS. This is one that is frequently found in groundwater at sites with firefighting foam contamination. The average in Westfield in blood, the average blood level in Westfield was over 3 times the average in the general population. The study also found some other trends consistent with previous studies. So PFAS levels tended to be higher in men than women, tended to be higher in older people compared to younger people, and it was higher in women that had not reported breastfeeding. Unfortunately, we know that PFAS can be passed along through pregnancy and breastfeeding. Okay, so the last big topic that I wanted to cover was on medical education. And there's actually been a pretty substantial update at the federal level that I'll tell you about. And then I also wanted to talk about some resources that our PFAS REACH team has been working on related to this topic. So for PFAS impacted communities, once PFAS have been discovered in local water or in the local environment, there are some common challenges that I've certainly heard from talking with people in many different impacted communities. So a common question or need from people is to test their own blood for PFAS so that they can get a better handle on the level of their individual exposure. But blood testing is often unavailable and expensive, and they're often told that it's not that helpful for individuals to get their blood tested. People who do have their blood tested may bring their results to their doctors, only to find that their doctors don't really know anything about PFAS because it's not really part of traditional medical training, not even just specifically PFAS, but environmental chemicals in general. People might have questions about levels of PFAS in their local water supplies. We are fortunate here in Massachusetts that there has been extensive testing of water supplies. The same is not true in many other states where there's no state standard and where states haven't necessarily emphasized widespread water testing. We do think a lot about water as an important source of exposure, but we can also be exposed to PFAS through food. And in areas with environmental contamination, fish and shellfish and other types of foods may represent a substantial source of exposure to local communities, but often the information about where the contamination occurs is limited. And we also often hear from people who want to be part of a health study. They recognize, that their own exposures can't be changed, but that there's an opportunity to learn from them. And there's often few opportunities for health studies. So in response to questions from communities and the recognition that there needs to be more training for medical professionals to be able to work with PFAS impacted communities, the National Academies of Sciences, Engineering, and Medicine established a panel that focused on guidance on PFAS exposure, testing, and clinical follow-up. This was a science panel that was requested by ATSDR and by the National Institute of Environmental Health Sciences. And so they conducted an extensive review of the scientific body of evidence to better understand and summarize the links between PFAS exposures and health effects. They also had a series of town hall meetings, and I thought this was really important and really effective. They heard from community members all across the country to better understand the challenges of people in PFAS impacted communities. And they had about 40 community liaisons who were both community members as well as public health scientists, such as myself, who work closely with PFAS impacted communities, again, to better inform the process and better understand the concerns and challenges of PFAS impacted communities. So the report from the National Academies panel came out in July. And this headline from WBUR does a good job of summarizing some of the key findings. So the report did recommend PFAS blood tests and medical monitoring for people with elevated exposures to PFAS. So diving in a little bit more specifically, the report did recommend that for people who are likely to have elevated exposures to PFAS, the report said that they should be offered PFAS blood testing and said that the benefit of having that information outweighed some of the potential drawbacks of offering PFAS blood testing. They also developed a series of priority medical screenings for people based on the results of their PFAS blood test. And I know you can't read the specifics here, but what I wanted to show is that they do make some specific recommendations based on the results of PFAS blood tests of certain types of screenings that they recommend to be offered to people, especially those who have relatively high levels of PFAS in their blood. And they also recommend exposure reduction for people who have experienced elevated exposures. So I put the link here at the bottom, the report does a really nice job, and I think it's really the first time that a federal agency has said, yes, it is helpful for individuals to have information about the levels of PFAS in their bodies. Typically, health agencies have said, well, that kind of information is helpful at a population level or community level, or maybe as part of a health study, but they often have cautioned against worrying individuals who might be concerned to know that they have PFAS in their bodies. But I thought the National Academies did a nice job in talking about the benefits of offering that, and that with the right type of context that people can learn from and be empowered by having those results. And just the last thing is that, so this has been issued as a report from the National Academies, and ATSDR, as I said, they asked for this report to be done to inform their own medical guidance, has said that they will take into account these recommendations and update their own guidance documents. So I mentioned the PFAS exchange. This was developed again by our PFAS REACH team. And we also have been working closely with medical professionals. In previous webinars, I've described our medical monitoring guidance documents. These are intended for patients and clinicians to be aware of different types of health screenings that might be considered for people who have had elevated exposures. For health effects where we've seen a link in the past between higher PFAS exposure and greater prevalence of certain health outcomes like changes in thyroid hormone levels or elevated cholesterol, our guidance document makes suggestions for the types of medical tests that might be appropriate for people with high exposures. And the National Academies report actually cited our medical monitoring guidance documents as a good example of clear guidance for medical professionals. We also are pleased to announce that we've developed a CME course. So CME is continuing medical education. And so this is intended to provide education to clinicians to help them learn about PFAS blood testing, medical monitoring, PFAS health effects, and provide really targeted guidance to help medical professionals work with their patients. So this is available on this new page on our PFAS Exchange website, resources for clinicians. For people who are medical professionals and want the CME credits, they are able to take this course through the Mercy Hospital in Kansas City. We also, you can see here the partners that worked on this project. We worked with the Pediatric Environmental Health Specialty Unit, Region 6. We worked with Michigan State and some of the other partners of PFAS REACH, and with the PFAS Action Group on Nantucket and the PFAS Cottage Hospital. So our PFAS Exchange resources for clinicians also has all of our fact sheets as well related to medical monitoring and other topics relevant for clinicians. And I also wanted to remind you that on our PFAS Exchange website that we have a tool called What's My Exposure that's helpful for interpreting the results of drinking water and blood testing. It compares your results to benchmarks and standards, and we've just updated it to reflect the new National Academies guidance. And so the idea here is that it helps provide context for individual results and also provides additional information about where PFAS exposures can come from, PFAS health effects, and tips for reducing exposure. So wrapping up here, thinking about what you can do and some sort of bigger picture outcomes. So there are some things that we can do at an individual level to reduce our own exposures and our family's exposures, as well as to take steps as informed and educated residents here in the US. So at an individual level, there are some things we can do, like avoiding microwave popcorn, eating more fresh foods, skipping stain-resistant coatings on furnishings. These can help reduce our exposure at a household level. though I would say that it shouldn't be on consumers to have to try to figure out when they're shopping for products for their family, which products are likely to contain toxic chemicals and which ones aren't. You can let retailers know that you want products that don't contain PFAS or other toxic chemicals. And we've really seen a lot of action from retailers making pledges to stop selling or using products that contain PFAS. And that's really helping drive the market forward. At a broader level, you can support stricter chemical safety testing and get out and vote and support candidates that are in favor of stricter chemical standards. You can attend webinars like this and learn and share information with other people and stay up to date about state and local legislation. And I know the Massachusetts Breast Cancer Coalition is one resource for learning about legislation here at the state level in Massachusetts. Silent Spring Institute also developed a smartphone app called Detox Me, which has lots of everyday tips and do-it-yourself recipes to help you reduce your exposure to toxic chemicals, not just PFAS, but others as well. And this is available for Android and iPhone. Some other resources, I've mentioned our PFAS exchange. We also have fact sheets where you can learn about topics such as PFAS health effects, PFAS in drinking water, and how to reduce your exposure. And the STEEP Superfund research site, which I mentioned, we've worked with STEEP to work on a private well study on Cape Cod. I'm also happy to announce that STEEP has been renewed for another 5 years of funding, and so we'll continue to extend our PFAS exposure testing on Cape Cod, as well as work with the broader STEEP team to better understand exposures and health effects of PFAS. And some parting thoughts. So as we've talked about today, so PFAS are showing up in drinking water supplies. And as we extend testing, we're going to continue to find them in more and more places. Sometimes it's not unexpected where they show up at higher levels, and sometimes it is kind of unexpected. And it does really point to the need for a lot of testing so that we can really get a handle on where PFAS are present at the highest levels. The EPA I'd say, is likely to set a standard, and that's an important step because there are many states that haven't yet taken action to restrict PFAS in drinking water, and that will be an important step forward to provide more even protection. It will mean that public water supplies will have to start testing for PFAS if they're not already, but it will only be a first step. At this point, it's only PFAS and PFOA that are being considered. There is some other important action happening at the federal level, such as PFAS and PFOA being added. Has been, I think it's still proposed and hasn't gone into effect yet, for PFAS and PFOA to be added to CERCLA, which is the Superfund law. And that's an important step forward towards establishing remediation and identifying responsible parties at contaminated sites to help address sites with this type of contamination. I think another trend is that increasingly we're seeing that waste streams, so wastewater treatment plants and septic systems and land applied biosolids, are increasingly being recognized as sources of water contamination. And we continue to see that states and retailers are really leading on restricting PFAS as a class in products. So with that, I'll wind down here, and yeah, thanks for your attention and look forward to answering some questions.
Thank you so much, Dr. Schaider, for that really well-developed presentation and a lot of information there to unpack. I do want to ask anyone who's on the webinar who has a question to post their question in the section marked questions in the panel to the side of your screen. If you open up that window for questions, there'll be a space there to type in your question. We do have a question from Valerie Fine-Zachary. She indicates that she noticed that Wellfleet had a red test and was wondering if it comes from the former DDT spraying back in the 60s. And I think that's two parts, right? The idea that DDT, an insecticide, could have a PFAS chemical in it, and then the second part being a forever chemical. How long is forever?
Yeah, those are great questions. And I just was actually talking to a reporter from the Outer Cape about those private well results out in Wellfleet. And the highest level that was found out there was 139 parts per trillion PFAS, which to me stands out beyond just what might be coming from a septic system. So I don't know if anyone knows yet what the source might be. It is a good question about pesticides as a possible source of PFAS. I am aware of more recent studies that have found that pesticides can have PFAS coming along with them. The thought is that they might be coming from the plastic containers that are sometimes have fluorine added, and so the surfaces of those plastic bottles can contain PFAS, and that can get into the pesticide. Certainly DDT is something that we worry about, and DDT is another type of forever chemical because it's still part of our environment, even though it's been banned for decades. I would think that if the DDT spraying ended in the 60s, it's probably not likely to have co-occurred with PFAS. PFAS, while it started to be added to products in the 1950s, I don't know if it was widely sort of added or likely to co-occur with DDT. But that's a really good question, and I know people in Wellfleet are wanting to know more about where those PFAS are coming from. Oh, we can't hear you, Barbara.
Sorry, I muted myself to make sure that we could hear your answer. Instead of existing bills being introduced, we anticipate a Maine style bill to be introduced. And that I have the name of who submitted that, but do you want to differentiate for people online what the difference between what has been introduced with respect to Massachusetts and what Maine has introduced as being a more broad bill?
Sure. Well, I'm not the policy expert here, and Dr. Malkus, you may have more to add. My understanding is that the Maine bill is very comprehensive. I don't have the wording right in front of me, but it's pretty broadly worded to include intentionally added PFAS in products, kind of writ large. And so that's really, I think it was really the first and most extensive ban that I've seen at the state level. So far, the legislation here in Massachusetts and in other states has kind of focused on a certain type of product, like one at a time, like one bill on food packaging, one on children's products, one on textiles, one on cosmetics. So sort of taking different categories one at a time. And I'm sure the policy experts out there can kind of weigh the pros and cons of the different types of approaches. But I think as more states, either individually or as a much broader class of products, address PFAS as a class, that's really going to start putting pressure on retailers to move away from having PFAS in their products. They don't want to have some products that can go for some states and other products that can go for other states. And seeing action, particularly in California, which is a much larger state, is encouraging.
We do have a question that I think is an interesting one. Do we have a sense of what it is? What is the cost of blood testing for PFAS, and is it cost prohibitive? Does insurance cover it?
That's a great question. And I should have mentioned that on our PFAS Exchange website, we also provide information about PFAS blood testing. We have a fact sheet with general information. So if you're approaching a blood testing lab, what are some questions to be aware of? And we also have a spreadsheet kind of document with information about specific laboratories. So the answer is a little complicated. It may depend on where you live. I think for some people it is cost prohibitive if people have to pay the cost out of pocket. Generally, the price for one PFAS blood test is in the order of $400 to $600. Insurance often may not cover that cost, although the state of New Hampshire does require insurance providers to cover the cost of PFAS blood tests. Anecdotally, it's still difficult for people even in New Hampshire to get access to a test, but at least in terms of the rules, and I think New Hampshire is the only state that's requiring insurance providers to pay for that. So it is available. There, Quest, which is a kind of common lab, does offer a PFAS blood test. There's some pros and cons of different tests, and some are more complete than others. So it's possible, but for some people, it's really difficult to access, and it can be cost prohibitive for people who have to pay that out of pocket.
Laura Spark gave us some information on the legislation that none of the bills that went forward during this session uh, did go forward, but there's great hope for progress in the next session. So thank you, Laura, for that. And then I see, this is a little hard to navigate these questions because they come flying in. So what's going on in New Hampshire and that they are so on top of the PFAS issue? Why are they seem to be more ahead of us?
Yeah, that's a great question. I mean, there have definitely been, I think it's a combination of effective advocacy from some of the community groups there, as well as legislators in the state being really on top of this issue. So, yeah, I think a combination of those factors. I don't know exactly how the New Hampshire insurance bill came together, but I'm hoping that it will be a model for other states to adopt.
And I wanted to make sure that we got to Gabrielle's question because it really resonates for me as well, as, you know, being a homeowner, but also a resident. You know, you talked a little bit about like removing PFAS from our drinking water, and we think of water really as very foundational, right? It's very foundational to existence. And so let's round off this session with talking about what can we do as private citizens to remove PFAS from water if we happen to live in one of those communities that's testing high.
Mm-hmm. Yeah, and that's a great question and a question that I frequently hear. So I think there's a few layers to this question. So I generally tell people to learn as much as they can about what's in their drinking water. So if they're on a public water supply, to call their public water supplier, or to look, often there's resources online. So to learn about the results of testing, learn if their water supplier is taking action. Oftentimes a water supplier will turn off or install treatment on a system that has contamination. So levels can change over time for that reason. But if people live in an area where there is PFAS in the water and they want to take some steps at the household level to address that, I steer people more towards treatment rather than bottled water. Bottled water, even when it has a picture of a beautiful mountain stream, doesn't necessarily come from a pristine area. There's very little testing for PFAS in bottled water. And bottled water has a lot of other negatives, such as plastic, the plastic needed to make the bottles and the plastic waste, as well as the energy needed to transport water. Water's heavy, and so it takes a lot of energy to move around. So I would steer people more towards water filtration systems, generally speaking, activated carbon-based systems and reverse osmosis systems. Both can remove PFAS from drinking water. Activated carbon can be in a filter pitcher. So you see the granular activated carbon kind of pitcher filters. And then there's also under the sink types of filters that have a solid carbon block. Those have more surface area and generally are better at removing contaminants. Both of those can remove PFAS chemicals. Generally, they're more effective for the longer chain or legacy compounds. But for any of these filters, it's important to change them out as the manufacturer recommends. Otherwise, the PFAS that stick onto the filter over time can be released and go back into the water. Reverse osmosis systems are also effective. Typically are used at the point of use and can be effective at removing both short and long chain PFAS. They do get out a lot of other ions as well, and so it can affect the. So that's important to consider when you're trying to decide what type of water filtration system to use. And if you have a septic system, it's important to think about the stream of wastewater that can come from a reverse osmosis system. So they're typically not used for the whole house, but just at the point of use.
I do want to add that Clean Water Action indicates that a very comprehensive bill will be introduced in the next session. And instead of one bill on food packaging, one on children's products, etc., separating them out by category, They do expect that the bill will not only ban most PFAS uses as Maine did, but also ban particular product categories based on research done by the Silent Spring and others. So we ask that anybody who's listening in today or maybe listening to the recording to pay attention and support that legislation when it comes forward in the next legislative session. I want to thank you so much, Dr. Schaider, on behalf of myself, the MBCC board, Cheryl Asimo, our executive director, and this was a very informative discussion. I always love when you come to our MBCC webinars because you provide us with so much information and action steps that we can take to preserve our own health and the integrity of our health, as well as the health of our communities. I want to thank all of our many listeners for joining us today. For those interested, the recording of this webinar will be made available later today on the MBCC website and located at mbcc.org. Thank you so much for listening and have a great afternoon and a happy Thanksgiving.